Okay, so let's move on here. So some of the terms that we use in healthcare. There is a lot of terminology. Healthcare is a never-ending thing. As things go on, as things change, there is always some kind of new term coming into the market. So it's a never-ending phase. I am still learning. I am 10 years into this healthcare market. I am still learning new terminology every day. No matter what it is, but there are some terms we definitely use in the marketplace. We definitely use in, when I say marketplace, I'm talking about our health insurance industry. Health insurance industry uses a very, very common terms here. So on the first bullet point here, the patient, okay? So we don't call patient a patient. In the health insurance industry, we call a patient as a member. So the membership data will come through what we call it enrollment data. Membership data, enrollment data, that means the same thing. The 834, what is this? This is the EDI transaction. So there is a file format that is used to send membership data from one system to another system. That file format is actually called an 834. On the second bullet point, we talk about doctor. Obviously, we don't refer doctors as doctors in the health insurance industry. We call it as provider data. I want to say provider. So to remember that difference, patient is a member, doctor is a provider. So why would you call that? Patient is a member because you're paying a certain premium in order for United Health to cover for your health insurance, and we call you as a member. You are a member of United Health. You are a member of Aetna. You are a member of some health insurance company. A doctor is a provider. Provider it doesn't matter which. Some providers have contracted agreement with some major healthcare players, but most of the time doctors accept insurance from all different payers, meaning Aetna, United Health, any health insurance plan as such. The next bullet point is hospital. So in a hospital, sometimes we basically refer as hospital or institution. So there are two terms that we use in the hospital setting. We use inpatient and outpatient setting. One good example of an inpatient is somebody had a baby and you have to stay in the hospital for 1 week. So there is an admit date and there is a discharge date. One example would be you got admitted on Monday to have a baby and you got discharged on Friday. So there is admit date and there is discharge date. And that's what you call it as inpatient. You're actually staying in the hospital for 1 week. Outpatient setting, I gave you an example just now. So you went to the hospital to get your heart checked. So just because the clinics, the doctor's clinic don't have all the equipment, hospitals have the equipment, the provider would say, hey, why don't you go to this clinic and get your heart checked? They would actually refer you to the hospital, and you go there early in the morning, and you'll be done like by midday. So that would be an outpatient setting. The next bullet point, we talk about payers. We have different kind of payers. We have Aetna, United Health, ABC Health Insurance. There are so many health insurance companies in the market. And so you can actually go through a list of all those payers. So why do we call payers? Because we pay for your health insurance, and you pay the premium. A member pays the premium, and we pay for your health insurance. So, for example, you don't go pay $500 every time you go and visit a doctor. Just because you're paying a premium of $600 a month, we cover you for all the health insurance, all the doctor visits. So the cost is very, very low. If you don't have health insurance, I had a family member who had a baby without a health insurance, every time you go to the visit, you actually pay $1,000 to the doctor because your maternity was not covered at that time. You actually pay $1,000 every visit. So what if you have health insurance? So if you have health insurance, you wouldn't pay $1,000 a month, so $1,000 per every visit. Maybe you throw maybe $100, $150. So that's a savings, because we pay for the rest of the cost. Okay, so moving on to the next part, which is that Hipaa transaction. This is where we are. So the Hipaa transactions are basically the EDI transactions. So what we use nowadays, health insurance industries are actually moving into Hipaa transactions a lot. A lot of manual processes, proprietary file layouts is all done. So, so this is the Health Insurance Portability Affordable Act. So as part of this, the Health Insurance Portability and Affordable Care Act, every health insurance company must use a standard file format when they are sending a file from one system to another system. Okay, and that's what we call Hipaa transactions. So there was 4010A transaction, there was 4010, there was 4010A, now it's all 5010. So all the transactions are 5010 compliant. So these are all different versions that we have. So again, so the Hipaa transactions are the file format. This is the electronic data interchange EDI file format. It's a very standard format that we use in the marketplace, I mean the health insurance market, where you have to use this format in order for you to send data from one system to another system. Okay, so let's move on here. So 837I, you have 837P, you have 276 and 277. So these are all the different file formats and the different purposes. So 837I is an institutional claim format used for inpatient and outpatient setting. 837P is a professional claim file format used by the doctors. If the doctor is sending a claim to a health insurance company, you have to use 837P for all the doctor visits and such. If you went to that example that I gave you, somebody had a baby, and obviously the hospital needs to get paid, so they would actually send an inpatient claim to United Health. So the way they send it is basically is using that 837I. And you have outpatient as well. So somebody went to go check their heart, you basically use the 837I, but the outpatient data actually goes there. So there is pharmacy data, there is dental data. We're not going to cover that because 80% of the market is actually focused on 837, 835, 276, 277. 835, think of this as an electronic check. It's called a remittance advice. So doctors must get paid. So once you process the claim, we actually send an 835 to the payment gateway. So you actually get a payment. So think of this as an electronic, something like a wire transfer, I want to say. It's not exactly wire transfer, but it's very closely related to that because that has payment information and such. You have 276 and 277. That's the claim status request and response. If somebody wants to know claim status or where we are at, is it pending, is it paid, what's happening with my claim, you can send it to 276 and 277. There is 270, 271, there is 278. There's a lot of transactions out there. Because, as we go through this demo, I will actually show you an example. I would actually walk you through a claims lifecycle. Trading partners or clearing houses, so think of this as a technology-based companies who specialize in EDI transactions. Technical companies, technology hubs who specialize in EDI transactions. So there is system A, so say for example, a doctor's office is sending, say for example, a major heart hospital is sending a claims to United Health. between United Health and this major hospital, there are trading partners sitting in between our clearinghouse. These are technical organizations who focus on EDI transactions. They work on cleaning up the data, they massage the data, they help the payers, making sure the format is validated, all the EDI transaction is up to the standard and all of that. Okay. So we'll cover this in more detail as we go through a demo, as we go through the claims lifecycle in the next few minutes. You have this claims lifecycle. How does a claim get processed? There are different statuses of a claim. You have penned, you have paid, you have denied, you have on hold. You can sometimes say there's different statuses as well. The most generic standard statuses that we see here is penned, paid, denied, and hold. So every system has their own statuses nowadays. As you can see, TriZetto's tools, claim system, facets, and QNXT. They follow the same methodology. They have different statuses. So there is a HP product called Metavance. They have a different statuses. It's dependent on the system, but the terms are very generic. The purpose is still the same. Paid means this claim is paid. Denied means this claim is denied. Pended means this claim is pended. Okay? It's pretty straightforward. It's just the terms are different. That's it. Explanation of payment, EOBs and EOPs. The federal government has mandated by law that every health insurance company, once you go to the doctor visit, you must send an explanation of payment and explanation of benefits to all the members. So I'm sure most of you have health insurance. You get a lot of mail from, I want to say United Health, Aetna, whatever the payer you have. Do you get a lot of mail from the health insurance companies because you just visited a doctor and you get a mail to your address? So if you open that letter on the right-hand side top corner, it would actually say explanation of payment or explanation of benefits. Meaning, so you went to the doctor, and this is how much copay you paid, and this is how much we paid to the doctor, and if there is any balance as such, they would actually put that in there. So EOB, they would actually explain you about the benefit, if you have met your deductible or not. If you have not, this is what you pay, and if you have met your deductible, you don't need to pay. And there's a lot of technical details in there. So we can go through that in much more detail, but the purpose really here is to understand the real need of an EOB and an EOP. It's just the letter that you get in mail explaining the payments of your last visit to the doctor or to the hospital, and also explaining the benefits. So these two letters are different, okay? All right, so before I start, so I wanted to go, so this slide actually focuses on health insurance claims lifecycle. So how does a typical health insurance company get the claim? Okay, so I put this diagram together and a slideshow. So I'm going to walk you through this scenario. So please pay attention here. This may be a little complicated for you, I guess. So let me, this is the health insurance electronic claims end-to-end process. Now, when I say electronic claims, we use Hipaa Transactions, okay? All right, so there are a few things that we need. So this, in a business analysis term, we call this a swim lane diagram. So I put this in a swim lane diagram so you can see all the differences, how a claim gets processed from one stage to another stage from an end-to-end perspective. Okay, so we have members. The members are nothing but you and me, right? So I am a member of Blue Cross, you are a member of United Health, some other person is a member of Aetna. So people who pay premium are the members, basically. And the next one, you have providers. Remember what I said, providers are doctors, right? Providers are also hospitals. So we consider providers as hospitals as well. So you have providers, you have hospitals. So for this diagram, I put it providers and hospitals under one swim lane. And just, you will understand this when I walk you through the scenario. And the next part is the trading partners or clearing house. And trading partners, like I said, are companies who are technology companies who specialize in inbound and outbound electronic transactions. They help health insurance companies to massage the data, package the data, so it can be easily consumed. So these are all technical companies. So one example is TriZetto. TriZetto also acts as a trading partner. So you have MDON. MDON is also a clearinghouse and a trading partner who specializes in the payments transactions like 835 and such. I used to work for a company called SDS. So this is a very small company based in Midwest. So these companies specialize in EDI transactions. They take the EDI transactions from the doctor's office and the hospitals, and they massage the data, and they send it to health insurance companies, right? So now we have health insurance companies here. So there are different health insurance companies. You have United Health, you have Blue Cross, you have Aetna, you have so many companies out there who provide health insurance. Okay, so in this scenario, so I'm actually going to walk through a couple of scenarios here. So one would be an individual member. So I am paying my own health insurance. Let's take me as an example. I'm a consultant. I pay my own health insurance to United Health, and I pay from my pocket on a monthly basis. Because I don't work for any employer. I work for myself, so I pay for my own health insurance benefits for me. Okay. Now, if you see the scenario here, so we have a member. So that's me, the blue man, and we have a doctor. So this is my doctor who I go to, and I have trading partners. So remember, this company is a technology company. It's a technical hub where they actually get a lot of data, process it, and they send it to health insurance companies. So you have United, Cigna, WellPoint, Aetna, Humana. So there are so many companies out there who actually provide health insurance. Health insurance where you can actually go there and buy health insurance. All right. Okay. So the next part is basically your claim systems, right? Facet is one system. You have QNXT and you have MetaVan. So these are different claim systems that are available in the market. You have Facet and QNXT. This is TriZetto products. These are TriZetto proprietary products. These are claims adjudication systems, very specifically used for certain markets as well. So QNXT is used more on the the Medicare side, the government side. This is actually a brand new product on the TriZetto side. You have MetaVan. MetaVan is basically your HP, the Hewlett Packard system. This is, again, another claims adjudication system. So remember, the claims adjudicate the system where we actually adjudicate a claim meaning process a claim. So in this scenario that I'm going to walk through is basically I am the individual policyholder of United Health System, and I am a member of this United Health. I'm going to pay everything from my pocket, meaning I pay my own health insurance to United Health. I'm not I don't work for any employer. And in this scenario, I am actually going for a doctor visit. So I have a doctor, a very close by doctor. Let's just say John is my doctor, okay? So he is my PCP, he is my primary care physician, and I go to this doctor. So in this example, just because of the season, it's the spring season, I am actually going to get a flu shot. So I'm actually going to get a flu shot, and I'm going to visit my doctor, right? So the first step happens is basically that's my doctor's visit. So I go to the doctor to get a flu shot. The first thing happens is the administrative assistant at the doctor's office will look at my insurance card. She or he will take my insurance card, and she will actually look me in their system and making sure I am still active, I am paying my premium. Again, in this case, my doctor accepts United Health members. So that's the criteria too. Some doctors accept certain insurance and such. Our assumption for this is basically my doctor accepts my United Health insurance. So I went to the doctor to get a flu shot. The administrative assistant at the doctor's office verified my insurance. It's all good. I had to pay $25 copay, and I paid that. I went to the doctor, and the doctor gave me a $300 worth of injection, flu shot per se. So I paid $25 from my pocket as copay, and doctor needs to get $275 from me, right? So from the health insurance company, because I paid my premium to United Healthcare. I don't have to pay $300 here, right? I don't have to pay because I'm actually paying my premium to help United Health. So that's why I only pay $25. So the doctor still needs to get $275. So in this case, my doctor is going to send a 837P file. 837P is a professional file. Excuse me for a minute. Okay. The doctor is actually sending a Hipaa transaction saying that, hey, I saw your member, Paul, and I gave him a flu shot. He paid me $25. I need $275, okay? So he's going to send an 837P to the trading partners, okay? Again, one more thing I want to clarify. These trading partners are actually behind the scenes. These are technology companies, so most of the time the providers, the doctor's office and health insurance company, they have a contract with the trading partners. They all work behind the scenes. So I want to show that process as well, because when you're actually working in the health insurance industry, you want to know who this trading partner is. Sometimes you have to work with the trading partners and such. So 837P is a professional claim, just because I went to the doctor at the doctor's office, and that's why I'm actually using an 837P. And it is mandated. You have to use 837P if you're actually going to a doctor. So it's the doctor's responsibility and the doctor's office responsibility to send it in a 837P, not 837I. 837I is used for hospital transactions only, okay? So now I got 830, so the doctor's office sent an 837P. It's a professional claim because they need to get to their $275. They send it to the trading partners right here. Okay, so 837P here, as you can see. Now, what happened right here is the doctor's office send it to the trading partners, and the trading partners massage the data. They process, they call it a SNC level edit. There are like 5 levels of edit. In other words, they're actually massaging the data, making sure this file is up to the standard, it meets the mandates and such. Okay, once they process it, they would actually send this file to the claim system. Okay. Now here, think, these are all the list of health insurance companies. Every company uses their own system. Okay. Now, as a part of this course, we focus on facets, QNXT, Metavance. We will actually compare these 3 tools and basically have a better understanding of how all these 3 systems work. What's the difference? Facets and QNXT obviously are very popular systems. These are TriZetto products. Okay. TriZero proprietary products here. So again, any logos and any information that is being used is basically proprietary to their systems right here. Again, as you can see, these are all the cleaning systems. You get, so in this scenario, you process, I send this 837P into one of these systems. Say, for example, United Health is using Facet system. I know a company that uses Meadowlands. Maybe Aetna is using QNXT. Okay. So it's being processed in one of the claim has been adjudicated. And the next step is basically once it is processed and the system is actually checking, hey, Paul is our member. The system verifies that, and Paul went to get a flu shot, and he paid $25. He pays $500 as premium, okay, and we cover for his flu shots, okay. So we can pay all $235 to the doctor. It's all good. So once it's all good, that's when actually they send in 835 here. 835 is the electronic remittance advice. Think of this as an electronic check or basically a wire transfer or something, okay? So they get it back to the doctor. So in this case, they don't actually physically send a check to the doctor's office. Basically, they deposit in doctor's bank lock boxes and such. Just for this diagram, and I want to show the doctor is getting paid, but behind the scenes, it's being deposited electronically into the doctor's account. Okay, so there are a couple of things that I want to go through. So as you can see here, once it is paid, so I went to the doctor with $300 of cost for my flu shot. I paid $25, and the doctor sent $275 here. It got processed, and health insurance company said it's all okay, and they sent an $835, and doctor got paid. Once the doctor gets paid, so this actually process happens simultaneously. A member, me, Paul, will get EOB, a letter saying explanation of benefits, and I also get a letter of explanation of payment. And most health insurance companies give you a login information where you can actually log in and actually log into your member portal and access EOB and EOP. And they also send mails as well. So if you check one of your mails from your hospital or a health insurance company, right-hand side top corner, you would see either this EOB, explanation of benefits, or explanation of payment. Okay, so this is one scenario where I went to the doctor's office and got a flu shot and all such. Okay, so in this process, I'm going to show you another scenario as well. Okay. I'm going to show you another scenario where a couple, say in this case, a couple who works for our company, a group policy. So I provide insurance for these couples. They basically both work for our company, and we provide insurance for them. So this group policy, they're having a baby. So obviously you have a baby at the hospital, right? So they need to go to the doctor's office, and they need to, the doctor will refer to the hospital, and this hospital is where you're going to get your baby. So in this example, I'm focusing on an inpatient setting where this lady who is part of LF Technologies went to hospital and stayed in the hospital for 1 week, and she had a baby, okay? That's the scenario. All right, so she went to the hospital visit. It was an inpatient setting. She joined hospital. She was admitted to the hospital on Monday, and she stayed for 1 week, and she had a baby somewhere on Wednesday, and she got discharged on Friday. Okay, that's the scenario here. All right. So when a couple from LF Technologies went and had a baby, The hospital will actually, again, they will go through this process. They will verify members' health insurance. There's a lot of paperwork involved. There's a lot of medication. She had a surgery. She met multiple doctors, and the baby had a lot of tests, ear tests, eye tests, whatever the test is. Baby, once the baby is born, the baby goes through a lot of tests. Baby is being taken care and at the daycare in the hospital as well. So obviously, the hospital will charge for that too. Right? And so baby has been taken care of while mom is recovering. They took care of the baby for a few hours at night. So all of that is cost. Okay. So my employee, she had a baby, and hospital sent a bill for say $20,000. Okay, and because she is part of my, so the couple are basically technology employees, and we pay for their health insurance, and we pay a premium. Again, a group insurance is also covered under. So we bought health insurance from United Health. Okay, so as a group, we have a group of employees, say 15 employees, and we have a group insurance from United Healthcare, and all our insurances are covered for that. So a hospital actually sent an 837I, which is inpatient outpatient. So whenever hospital is sending a claim to health insurance company, they always have to send an 837I. Okay, so in this case, we sent an 837I. This 837I is very, very complicated transactions because she went through a lot, right? She saw at least 4 or 5 doctors. She had a baby. She recovered. They gave a lot of medications, painkillers. They took care of the baby at the daycare, and the baby actually had a lot of tests as well. So all of this is cost. In the hospital, you need to get all of that money. Okay. In this case, say, for example, let's just say, the hospital charged $20,000. So they send an 837I. That's a huge transaction. Again, it goes through the same process. It goes through the training partners. They will actually massage the data, and they will send all of that information into our claim system. So one of these claim systems will get that depending on the payer, company which is using these systems. They will get this 837I, and they will actually process this transaction. And the same process occurs again. So once the 837I is sent, they process it, and you actually get the payment. So it's all good. She's part of the employer group, and for LX Technologies, we got everything covered for her, and we're going to send an 835 transaction. So the difference here, you see, 835 is used for both AP and I. So we use the same transaction. There's nothing called 835P or 835I. It's the same transaction. But the claim format is different. When the doctor sends the claim to the health insurance, it's 837P, and then hospital sends the claim to the health insurance companies, it's 837I. Again, the process is still the same. You're going to get a bill showing EOB, explaining the payment, explanation of benefits. The process is still the same. So the difference is the bill. So here it's $235, here it's $20,000, okay? And hospital covered for everything because we have a coverage, maternity coverage and such, and this is all good, okay? So again, so there are many, many transactions that I have not I didn't show in this workflow diagram, but these are the most common transactions. So there is another transaction we use that's called 276 and 277. It's the claim status request and response. There is 270, 271, that is a eligibility status request and response. There is 278, there is the authorization file. That's another transaction. So as a part of this course, we're going to know each and every transaction in much more detail. In the purpose of that transaction, we're going to interpret a EDI transaction as well. So that will be covered in more detail. And also, we will be covering the facets, the QNXT systems in much more detail as to how these systems look like. How do you look for a claim? What are all the basic things that you need to know about traffic? What is the real purpose of it? Okay. So at the end of the day, as you can see, no matter what system you use, the data is still the same. There is membership data, meaning your data and my data for my payment information, my address information. There is provider data. There is doctor's data, because doctors also have a contract with the health insurance companies. So there is provider data. There is payment data. So that's the payment data. There is benefits data. Benefits data meaning I pay $500 and somebody else might pay $800 as premium because this person has more coverage. So there are different types of health coverages based on your premium. For different levels as such. So depending on your level, depending on how much you pay as premium, your coverage is different. So that's all benefits information. Okay, and hope this slide actually gave you a good overview of how things work.